I think we have to start this over again. Jason said that you couldn't hear me. So hi, everyone. We'll start this again. My name is Michelle Grimolia. It is January 19th, 2021, a Tuesday. And I'd like to give a big shout out to my daughter, Anna, for her 14th birthday. I'm really glad that I get to be home to spend the day with you today. I know you'd rather be with your friends, but this is what happens when we are on remote school. So in terms of my update today, I will be covering a whole number of frequently asked questions following last weekend's vaccine clinic, and going through some things about what to expect for the next several weeks. I will be issuing a memo today that covers all of these topics. So if you hear something here and you need to hear it again, just please look out for that memo, and we will get that in writing to you as well. In the meantime, obviously everybody knows how to get in touch with me, so you can call me at my desk. Normally that's 845-256-5501 or internally extension 5501. Or you can email me at any time. Before we get going here, I would like to just thank the Daily Freeman for covering and giving us really fair and positive coverage of what we accomplished this past weekend. I was really pleased to see that, and it was nice to be able to tell a good news story. So I want to just say that because it really does mean a lot. So I'm actually just going to read to you from the memo that I wrote for today. It covers some basic information and then does cover some frequently asked questions. I think this should cover most of what I've heard from the weekend, and others have brought to my attention. So here we go. Dear all, what a weekend. We successfully added another 259 individuals to our total number on campus with their first vaccination. Adding that to the 138 that already got their first vaccination at the Clinic for Skilled Nursing, residents, and all the staff on January 8th, plus the scheduled number of those to be vaccinated with their first dose on the 24th, which is assisted living, Garden View residents, and the next round of staff members, we will have 460 plus residents and approved caregivers and staff that have had their first dose of vaccination. So that's really remarkable. We started this on the 8th. We had no idea how we were going to get the independent living folks vaccinated, as I've reported over and over the last few weeks. And now with the just enormous effort that happened last weekend and the enormous effort that's going to happen this upcoming weekend with some additional health center vaccines, we're going to have 460 of our people with their first dose of vaccination. It's really overwhelming. I go on to say in the memo that Erica Caliendo and the staff at the Institute for Family Health in New Paltz gave up their entire weekend and will do so again on the weekend of February 13th and 14th to get the second doses of our independent living vaccines administered. I think I mentioned before, but I'll just mention it again, that normally the Institute for Family Health is closed entirely on Saturdays and Sundays. And Erica had contacted me a week ago Sunday to say, I'll open for you. I'll open for your independent living residents so that they can be vaccinated. We have the vaccine. They all qualify, as do the caregivers, because they're providing direct hands-on care to our residents that need assistance with their activities of daily living, in some cases 24 hours a day. We will do this for you. And so a little army of, I don't know, maybe 15 amazing staff members each day assembled at the Family Health Institute for Family Health here on the corner of 299 and North Pot Corners Road, and gave almost 260, just shy, 259 of our independent living residents and their caregivers their first round of vaccine. And they came in, the staff members came in on their weekends to do it. And of course, you know, on our campus, Mary Jo was here through the weekend and available to all of you that had any questions. And Arlene Wilson was at the Institute throughout the course of the weekend, and she cried so many happy tears. She just seeing the joy in all of you just gave her so much joy, and she'll be back again the weekend of Valentine's Day when we repeat this. So we are indebted to the caring and selfless people at the Institute for Family Health. And of course, Mary Jo and the staff members that were on site. Sarah, thank you so much for coming in on Saturday morning. Arlene being there all weekend. For those that have asked, Erica's address is going to be included in the memo. It's just the Family Health Institute address. So I know that a number of you asked if you could send over notes of appreciation. And of course, I have not asked Erica that, but there's nothing better. And I'll tell you, getting a written note of thanks, it just means the world. So if you'd like to send a note over to Erica and her staff, certainly the address is in the memo today. Okay, so my memo goes on to cover the frequently asked questions that have come up as the result of the rounds of the vaccines that we've had. So the first is related to independent living. And it states, where is my vaccine card or certificate? So everyone that's being vaccinated for COVID, there's a standard, it's a card that's about this big, maybe 4 inches by 5 inches or so, maybe a little bit smaller. But it's on a thick cardstock, and it's each of you has one if you've been vaccinated your first round. I know for me personally, I was vaccinated on campus with a Pfizer vaccine. So when I was done, I was given the card. And when I go back, I need to bring that card back so the second dose can be added. It's a notation on the card as to when I had my first dose and the details of that dose. For independent living folks, I have all of the cards. So at the end of the day Saturday and at the end of the day Sunday, Erica gave me a stack in order of how you were all vaccinated, in order with the schedule. I have all of those cards. And so when we repeat what we did this past weekend in several weekends, I will bring those cards with me. After that, we'll have to make a decision. I would plan to give you the cards so that you have custody of them for using them as however you need to use them. But that will show that you've had the required 2 doses of your vaccine. What I would probably recommend, and we'll cross this bridge when we come to it, is that we actually make photocopies of the front and back of all of those cards before we give them to you, so that we have that on record. At this point in time, we have no indication from the CDC or the state or federal government as to what being vaccinated may entitle us to do down the road. But my thought process is that this will be needed at some point, maybe for travel, maybe for, participation in different congregate activities, those kinds of things. So I think it's going to be very important that each of us has custody of our own card. But I do think that Woodland Pond can help the process by keeping photocopies of them for you. So I think we'll probably do that. So just to sum that up, I will hang on to those cards for independent living folks until Saturday the 13th and Sunday the 14th, which is when we will repeat the vaccination clinic. For the skilled nursing residents that have already been vaccinated and the assisted living and Garden View residents that will be vaccinated on the 24th, our staff has those cards as well. So that's where we are with the cards. There is not a separate certificate. It's just that card. If you would like a copy of your card in the meantime and you live in independent living, or if you are a family member of someone in skilled nursing that's already been vaccinated, please contact me and I will get you a copy of that card, which will just have the 1 dose on it for now. The second question in my memo is, when are the next independent living clinic dates? So if you were vaccinated on this past Saturday, which was the 16th, your second dose or second clinic date will be Saturday the 13th. And if you were vaccinated on Sunday, you will have your second dose on the 14th of February, so Valentine's Day. The great news is that you do not have to do any additional paperwork. Everything that we did to prep this past weekend with getting insurance copies over to the Institute for Family Health and your consent forms that we had handed into concierge and the New York State online form, you don't need to do any of that again. So it's going to just be, hopefully, just as seamless as it was this past weekend. We intend to staff it the exact same way that it was staffed, with the same numbers of drivers. I'm having Arlene at the Institute. I will be in. I have not spoken to Mary Jo yet, but it is my hope that she plans to stay for the weekend again, and so on. So you do not have to do any paperwork. It's just your appointment, your next appointment for your second dose will be exactly 4 weeks after when your first dose was. We did have one scheduling snafu, which was entirely my fault on Saturday, which did impact a caregiver and 5 residents. I do apologize for that. We had a lot of moving parts last week, but we were able to resolve it. So my plan for those folks that were impacted is to update the master schedule to reflect when you were vaccinated this past weekend, and keep those same vaccination dates that we were able to secure for you. So again, I apologize for that. I'm pretty pleased that we only had one mistake out of the 260 opportunities to do so, and it only affected 6 people. And I greatly appreciate everybody being flexible and understanding. We knew going into this process that patience was going to be absolutely critical. Okay, so the next question is when will I be able to stop wearing my mask? So it's going to be a bit more time yet. And that's all going to be based on CDC guidance. This is not something that's going to be driven by Woodland Pond. So as long as the CDC continues to suggest that people wear masks, that's how long we're going to require it at Woodland Pond. So that will be driven by the CDC. There was a great article on this in the New York Times this past weekend. I don't remember if it was Friday or Saturday, but I asked the concierge to print out copies of that article for those that had not seen it. And if you're interested in reading that article, which really explains exactly why even folks that have been vaccinated need to wear their masks, you should definitely read that article. It gives some really good information. That being said, if you don't want to read that long form article, I do have a question on the memo today that says, why is this going to take so long? And the answer is the vaccines that we have all received to date have been proven to be effective at reducing one's risk of contracting COVID. And for those that do contract COVID, it will greatly reduce the impacts of the illness and the symptoms. So this vaccine, through the testing that's been completed to date, has been tested and proven effective for, number one, reducing or eliminating your risk of contracting COVID in the first place. And number two, ensuring that if you do in fact contract COVID, that you are much less likely to become seriously ill. You're much less likely to experience significant and concerning symptoms of COVID, and you're much less likely to have an illness progress to the extent that you need hospitalization. So this is about illness management. This is not necessarily about prevention. Although there is some evidence that says that you're much less likely to contract COVID if you have the vaccine. What has not been adequately or definitively determined yet is the extent to which the vaccine prevents myself from transmitting to another person. So because you do still have a risk of contracting COVID when you have the vaccine, although it's reduced, and because the risk of you transmitting COVID if you have it to another person has not been tested or proven, this is why the mask wearing is going to still be so critical. I would anticipate what we're hearing is masks are going to be required until well into the summer. And a lot of that timing is going to depend on, number one, what additional testing or studying of the vaccine determines at each of these vaccine manufacturers, and the extent to which the vaccine reduces the risk of transmission, but also the extent to which the numbers of folks in any particular area receive the vaccine. The faster some place or some region or some state can achieve herd immunity, those are the things that are going to determine whether or not the CDC feels we can stop wearing masks. So the masks are going to be here for a while, and so is the 6 feet distancing, because that's really a protection for transmission, whereas the vaccine is a protection for yourself to not experience significant illness if you do contract COVID. Okay, so when will I be fully vaccinated? All of the current vaccines being administered that have been issued under the FDA emergency use authorization are 2-dose vaccines. There are some vaccines right now in the early phases of approval seeking that are 1 dose, but the current ones that are in circulation are 2-dose vaccines. For the Moderna vaccine, which is what for the Moderna vaccine, which is what all of the independent living residents and the caregivers received this past weekend, it is a 2-dose vaccine with the doses 4 weeks apart. For the Pfizer vaccine, which is what our staff members are receiving, and the residents in assisted living and skilled nursing and Garden View are receiving, that is a 3-week apart dose for the Pfizer vaccine. So regardless of which vaccine you have, whether it's the Moderna or the Pfizer, 2 weeks after the second dose is when you're considered to be fully vaccinated. So for those that have been vaccinated already, you're well into your 6 weeks total if you're Moderna, and your 5-week total if you're Pfizer. So we're rapidly approaching that time frame. Okay, so when will we be able to resume allowing visitors on campus? And the answer to my question in the memo is that depends on where you live on campus. If you live in the health center, visitation is and continues to be directed by the New York State Department of Health. There has been no new guidance issued as to how vaccination will impact our ability to offer more frequent visits on campus for health center residents. So that's skilled nursing, assisted living, and Garden View. The New York State government and Department of Health will completely dictate that for us. I have no idea, and we've had absolutely no inclination or guidance yet from the state as to how they may treat folks that have been vaccinated in terms of allowing visitation. But it's our priority to ensure that just as many as possible staff and residents of the health center, and of course independent living, are vaccinated, because it's our hope that at some point sooner than later that makes a difference in terms of us being able to allow visitors and also congregate activity. If you live in independent living, the visitation policies are guided by the New York State Department of Health regulations, but we ultimately, as a leadership team, make the decisions about when the campus can be open for visitors. And the news there is a little bit more optimistic. We expect, based on the great numbers of those that have chosen to be vaccinated in independent living, which is well in excess of 99% of our residents, that we expect that we're going to have established herd immunity in independent living by the end of February. And that's basically, based on any measurement of herd immunity. This hasn't really been established yet for COVID and the vaccines, but with 99% of our residents being vaccinated and the vast majority of our staff, will be well in excess of 90 to 95% in independent living vaccinated. So it's our goal that by the end of February or early March that we have resumed allowing visitors on campus for independent living from off campus. We don't know what that's going to look like yet. I don't know exactly what those protocols and parameters are going to be, but we will be working on that aggressively over the next month to be ready for that full vaccination date of the end of February. The next question is, okay, so when can I visit my Woodland Pond neighbors indoors at Woodland Pond? So there does still seem to be some confusion, but residents should not be visiting with each other indoors in independent living. Nothing has changed. This has been the same protocol that has been in place for months at this point. We have been a little bit surprised to hear how many of you are visiting with each other indoors. We can't police what's happening at Woodland Pond, but we are not encouraging this by any means. No one until this past Saturday in independent living was vaccinated in independent living, and those that were vaccinated on Saturday have only had their first dose of a 2-dose vaccine that then requires additional time to be considered to be fully effective. So it's not considered to be something that we are recommending at this point. Every resident in independent living and throughout the community is high risk due to age. So at this point, you shouldn't be visiting with your neighbors indoors. You can certainly visit with your neighbors outdoors, and we're encouraging that. And you should all be participating in the various activities that we do have available in the community building, although most of those are solo. That's where you can get your neighbor to neighbor time right now. But it is our goal to resume independent living indoor visits among residents and neighbors by the end of February also, based on the same concept that we anticipate herd immunity to have been achieved by that time. For the health center residents, the New York State Department of Health is going to be directing all of the changes related to you visiting with your neighbor in the health center, congregate activities, and as I said, there are no known changes at this time. Okay, but what about introducing pods at Woodland Pond? So when we had initially discussed the idea of pods here in independent living at Woodland Pond back in December, this was under the expectation that we would not have access to vaccines for independent living residents until the summer or late spring. And so we were looking for a way to bridge that gap in time to allow some, resident to resident interaction indoors in a somewhat safe environment, with the expectation that it was going to be many months until we were able to access vaccines for all of you. Obviously, fate has intervened, and we have been able to access vaccines for all of you when, quite frankly, the folks in the community have not been able to do that. So we've been extremely fortunate. And what that means is that what we expected to be a full vaccination time frame many months from now is going to be dramatically accelerated. So all of you that have chosen to be vaccinated will have had your second dose within the next couple of weeks, and then we expect you to be fully vaccinated by the end of February or early March. So that timeline has been accelerated greatly. And we also, when we were talking about pods, didn't anticipate that quite so many residents in independent living and caregivers were going to be opting to have the vaccine. So the fact that we have such great numbers of participation, combined with the accelerated access to the vaccines, means that we are on track to be able to resume a good amount of congregate activity, including opening the dining room, with safety protocols, group meetings, card games, you name it, really in less than 6 weeks. So Sarah and I and the Residents Council need to really discuss the costs versus benefits of proceeding with any type of pods, given the fact that we're really on the cusp of, full vaccination for the vast majority of the community. I think personally, I hate to arbitrarily introduce risk when we know that we're just weeks away from being able to safely resume congregate activity, of course with safety protocols. But we've come so far and we've done so well, and we're so fortunate to be able to have these vaccines that I really need to be introspective and do some updated research now that we have vaccination started. Sarah and I need to do some soul searching. I'm going to get some feedback from the Residents Council this weekend, but the whole landscape has changed in the context of that discussion, because now we have vaccine that I did not think that we would have. So no decisions have been made definitively, but now, we're on the cusp, as I said, of having everybody or the substantial amount of the community in independent living, and also the skilled nursing facility and assisted living facility, to be fully or nearly fully vaccinated. So more to come on that. I am attending the Residents Council meeting this Thursday, and I know this will be discussed, but that's where we're at in terms of that discussion. In the memo, I do include our latest counts on campus. We have no residents that are currently positive on campus. So the COVID cohort in skilled nursing is empty. We do have a few staff members that have tested positive. You'll see in my memo that the couple of them are retests from folks that have tested positive. You know, we do keep seeing this. Where someone may have tested positive weeks or months ago and is being, you know, will test negative and then will retest positive again. We include all of those in our counts, even though they're not a new positive. We know that someone can be shedding this virus for 90 days or more. So this is not unusual, but we do report those as if they are a new onset of illness, and we do take those staff off of the schedule for the required periods of time. We do have a new staff member that tested positive that normally works in skilled nursing. She's per diem though, and she hasn't been on campus in several weeks. So although she's in our counts, there's no active risk at all. She just physically has not been on campus, I think, since close to the new year, if not before. You'll see our updated counts there. And that's all that I covered in my memo. I do just want to mention one thing, which is that a couple of you have reached out to me that are actually seeking vaccine and you live in independent living. Either you had opted out initially for this weekend or some circumstances changed that you are going to be wanting that vaccine. Unfortunately, the folks at the Institute for Family Health, their first round vaccines are completely gone. Our clinic this weekend, and then a couple of straggler appointments that they had, used up all of their first round vaccine. So, and they have no idea when they're going to be getting more. So the Institute had been, prior to Woodland Ponds Clinic this weekend, vaccinating qualified folks from the community. And they intend to do so again, which would allow us to facilitate appointments for those folks that still need a vaccine for their first round. But right now they're not making any of those appointments because they have no more first round vaccine and they do not know when they will be getting them. For the folks that were vaccinated this weekend, the Institute for Family Health already has the second round vaccine, and those are secured and on site at the Institute, but they cannot be used for first round vaccine. Those have to be given to the people that were vaccinated in the first round. So I will, give individual instructions to those that are trying to be vaccinated that were not this weekend in the Institute for Family Health rounds. You are unable to be vaccinated if you live in independent living through the vaccination process in the health center because it's done through a completely separate program, through a federally directed program through CVS Pharmacy. So we can't have independent living folks being vaccinated under that program. It's prohibited. And I just want to be very careful to let all of you know that all of us as providers that can potentially be facilitating vaccination. So this is the Institute for Family Health. This is Woodland Pond. This is CVS. This is your daughter or son-in-law that's a physician. Anyone or any entity that is determined to have violated the federal and state regulations about rolling out the vaccine is subject to a $1 million per violation penalty. So we cannot mess around with this, and none of us are willing to do so. We will help everyone find available vaccine if and when it becomes available, but we can't take any chances with violating the very rigid rules on this because $1 million a pop is not something that any of us wants to take a chance with. So anyway, I will be around. I am working from home today, but I'm working all day. I'll be in the office on Wednesday and Thursday, and then I'm off for a long weekend starting Friday. So if you need me today, give me a ring or reach me via email, and I'll talk to you soon. Thanks.